I think the committee members can stay up here. I want to thank you for the personal reflections. And I realize that this could be a much longer conversation, that there are layers and layers to what your journeys have been and how that then fed into this report. And I might mention that film was based on the dissertation of our Dean of the School of Education at my university, the Sage Colleges, Dean Laurie Quigley, and her mother was one of those students. And she talks about, because they were wrenched from their families, the siblings were even separated, and she talks about the fact that she can remember her mother hugging her once, because the children received no affection in these boarding schools. And so it's just one example of very, very many in many different communities in this country. And remember, we're thinking globally too. Around the world, the social determinants are very important. And the differences in access to education, to health care, to environmentally safe communities, on and on and on, exist in countries beyond the US. They exist to a shameful extent in the US, but we're not alone in facing these challenges. So I would like to open this up, and I don't know if Deborah Vozella Hall is here, who will introduce. I think I'd like to let her introduce herself, but I know that she wanted to begin with a question. Introduce yourself, though.
Yeah, I was. So my name is Deb Hall, and I'm currently the national president of the American Medical Student Association. And this report has been much anticipated by myself and much of our membership. The work that you're doing sits at the intersection of so many things that are so critical to the future of healthcare and healthcare education and delivery in this country. And first of all, I'd like to thank you, because the report that you delivered has not disappointed. It was much anticipated, and I was very, very pleased to read it. In particular, I appreciate that the recommendations that you make are actionable, that you demonstrate what you mean by community engagement and interprofessional health education. Doesn't mean that we sit next to one another in a lecture hall. Community engagement doesn't mean that we tell the community how to carry out our vision for what is good for them. And you touch on some of the really important points of the culture changes that are going to be needed. And the thing that I was curious about, I realize maybe a little bit outside of the scope of the work that you did, but I thought that you might probably have some insights given the wealth of experience we have here. And what we value in anything is often reflected by where we place our time and our money. And I know that the different payer models that we have all over the country and at private or public institutions drive how we are able to implement some of the suggestions that we find in this report. And I wondered if any of you could share any insights about what appear to be good models and models that promote change, and where we should maybe be looking.
So I'll just say one positive thing that I think has been happening in our healthcare system is the patient-centered medical home model. I think that is helping. I now sit in a school of medicine and a family medicine department, and I've shadowed some of my colleagues in their clinics to understand, what does a patient-centered medical home look like, or what is their interaction on a day-to-day basis, because they say that they are doing more team-based care. Now, we are in an academic medical center, so maybe we're on some leading edge, but I do get the sense that there is more of the appreciation about the need to talk and engage a social worker. I think they recognize that transportation is a big issue for a lot of their patients. And this is, when I say they, I mean the physicians, the nurses, it's everyone on staff who has kind of this onboard understanding, a better understanding of where the patient is coming from. Now, I think that patient-centered medical home still has some ways to go in terms of what it will really do to help improve patient care, but I do see that as a real transformation that's happening in our health system that was really put into place by putting some incentives in place through CMS, actually.
Yeah. Right. Thanks. So I think that, I mean, there are definite opportunities and signs of the culture change. And I'm trying to figure out oh, there you are. It's like, where did you go? I think that one, from our standpoint, as Bianca was just mentioning, as a payer, that CMS now has a model that's the accountable health communities. And that is a big transformation to switch from just focusing on reimbursing for care to really thinking about how do we address some of those social determinants as we're providing health and care to individuals, and particularly in sort of Medicare. And I think that is a huge first step. And I won't say a first step, but a huge step within a very large system that is very difficult to change and slow to change. I think that's great. I think looking as well, you're seeing within, the medical sphere and some of the competencies for some of the residency programs, you are seeing integration of health equity. And that's also very critically important. And how do we implement that and follow up? I think one of the critical pieces for all of this and why I think the committee felt it was so important to have the organizations is that they are part of this work. And we do know people do what you pay them to, people do what you hold them accountable for. And so making sure that we are from our foundations who are also looking at patient engagement and family engagement and how do we embed that and think about that beyond just here, take your medication, or here, go do this follow-up visit, to really, having that communication and making sure that we're talking about health literacy, that we're talking about some of those other factors that are important in whether or not someone is able to schedule a follow-up visit and show up because they may or may not have transportation. So I think we are beginning to see that. I think, it's great to have, and it was very great to have the global perspective, because I think in the US we've been a little bit slower to recognize the importance of the social determinants and to talk openly about that. And I think some of those earlier conversations from years ago of, I can't do anything about poverty, we're seeing less of and hearing less of, and getting more people to think about, we're going to have to try and tackle some of this if we're really going to make progress. So it's slow, but I think we're seeing some of those initial important steps that are moving us forward.
And I'd like to offer you a model. Speaking as a past president of SNMA, long time ago, 1978, 79. But the model is the Morehouse School of Medicine and their community health course. It's a one-year required course for every medical student. It's broken up into two halves. The first half, they work with community and faculty in identifying issues that are important to the community and building a program to address them. And then the second half of the year, they implement what it is they've come up with working with community. So it gives them a hands-on, right up front look at what the processes are, how you work with community, what social determinants means from the standpoint of a first-year medical student working with community. So it's a very positive program, and I don't know any others that are that excellent. The University of Minnesota does have a summer urban health equity course, which is it runs the entire summer, and all first-year students take this course. So that's not quite as elaborate or in depth as Morehouse, but it's an introduction.
Okay. Thank you. Are there other questions at this time? Now, I know we've had a fairly rich opportunity for discussion. If they're not, are there any final comments from any of our committee members?
I just want to reiterate the thank you to the Institute of Medicine and to Patricia Cuff and to all the people who assisted us. We're so grateful. Thank you very much.
Yeah. And yes?
I'm Karen Anderson. I'm IOM staff. So what are the plans for disseminating this report? Will you be working with some of the professional organizations like Dr. McNeely's organization to share your findings?
Go ahead. Sandy, did you want to take that? And
I already disseminated it to almost everybody I know at 11:03 yesterday when the report I had the email already, and as soon as it came out, I downloaded the report and the summary. Although I wasn't able to speak about what was in the report exactly, I said whatever I could to as many colleagues as I could to prepare them to get the report. I have to say, not more than 3 minutes after I sent the report to the dean of the medical school at Upstate and to the associate dean for academic affairs in the medical school, they wrote back to me and said, let's have coffee. We've been thinking about implementing this. Let's implement it together. And so we have, among the places that I've sent the report to are, of course, the Sage Colleges in Albany, the University at Buffalo, the School of Social Work and Public Health, especially at Buffalo, Upstate Medical University, Syracuse University, and Lemoyne College. And there's already interest in having collaborative work in this area.
And maybe you can follow on, Patricia, but I was going to mention that the Innovations in Health Profession Education Forum, first of all, I will personally thank them at our meeting in April for coming up with this idea, for promoting it, and actually the sponsors of the forum for becoming sponsors of the report. And I want to thank my co-chair of that forum, Malcolm Cox, as well. But we will be presenting at the forum meeting in April basically a synopsis of what you heard this morning of the report. And we certainly hope and expect that all of the members of the forum will not only use their various positions, and literally it is quite a range of foundations and institutions and national associations to promote this report, but also that they will use their networks to promote the report. I personally would like to see some discussions at national professional associations, particularly those involved in education. And again, I think that our network of people in this room, the committee, the people who are on the webinar, the sponsors, and the forum will be able to make a difference in this. It's a time when we can have some sessions, for example, on these topics. So Patricia may be able to add to that, but I will also say that in the forum, there are two topics that have come up this morning that are ongoing topics of discussion for the forum, and in one case is it's certainly under discussion for a workshop. I guess I can't make any promises until the forum makes a decision. But one of them is accreditation. And yeah, I see heads nodding, so just go from there. That's huge for this. And then a second one is financing, health professions education. And how do we get better at financing it? How do we make it affordable to a much wider range of populations than it's affordable to now? So those are two key kind of follow-on things that we will take responsibility in the forum for discussing and seeing how we can take next steps. Patricia, I don't know if there are other things on dissemination, or have I covered it? I know that some of the committee members are talking about some publications that they might do jointly or in various permutations to continue the discussion. So yeah, I'll let Patricia speak, and then some committee members may have some thoughts.
I think you covered it as far as the dissemination goes. We have every intention of taking the report forward. It'll be presented in a number of international and national meetings. We also have the intention of writing some articles and potentially other avenues of getting the report disseminated. And of course, every one of our sponsors and members of our global forum are welcome to individual briefings with their organization. So that's the same. But to follow up on what Susan said, they actually are official. We're having a workshop, which is separate from a study, but the Global Forum is running a workshop on accreditation, and it'll be April 21st and 22nd of this year. And then our next workshop will be on financing health professional education, That's taking place October 6th and 7th. And these are all in Washington, D.C., and they'll all be webcast for those who are joining us through the webcast.
And I know, Laura, that you may want to, I don't want to steal
just
your
want-
thunder.
yeah.
We're talking about Latin America, where both of us have lived and worked extensively.
Exactly.
Go ahead.
I just want to add that it's very important to translate and to disseminate this report in other parts of the world. I know that, for example, in Latin America, we need this in Spanish. So one of the things that we would like to make the recommendation and do forward is to publish the report in Spanish or to have an article of dissemination in Spanish that in the journal in Pajo that can be disseminated to whole Latin America. And the other part of the world, at least I know that they're going to be very interested to read this, is in Europe. So in that part, I think we can actually give presentations in international associations and conferences in order to really disseminate it in other parts of the world.
Yeah, we have two members of the committee who are based in Europe, and so that should help with dissemination there. And then I noticed Patrick Kelly had to leave, but he's been very much a strong supporter of the forum and of this activity. And one of the many, many other things on his plate is helping to coordinate our counterparts to the National Academy of Medicine in Africa. And I know he's also doing something similar in Latin America, but literally working with the academies of medicine in Africa, in Latin America. And so that becomes another vehicle, frankly, for disseminating and discussing this report. That's an example of some of the networks of the IOM, now NAM work globally, where we can have an impact on this. So just a few examples. Anybody want to add? Go ahead, Dr. Troutman.
We talked somewhat about certification as well as an additional item, particularly since the public health has now come up with the certification, the public health exam that's being given all over the country and being fostered as the important credential to have to demonstrate your basic knowledge in public health. No reason that this material on social determinants and educational issues shouldn't be a part of that certification exam for certainly public health, and why not for everybody else that we want to touch in this work.
Well, if there are not other questions, we've said some of the thank yous, although again, Patricia Cuff, I really want to thank you and your staff. I know how much work you did on this. I've thanked my fellow members of the forum and my co-chair, our sponsors. You've been more than sponsors. You've been inspirational. You've been part of the conversations, many of you, that we've had at the forum. And it's not been about, oh, here's some money to do a study. It's been about, here are ideas, here are things to think about, here's where there is a real need. And then, of course, you've trusted the committee, handed it over to the committee to do the work. But, and I know many of our sponsors are also probably on the web. So I do want to thank all of you very, very much. I think you're going to be very proud of the impact that this report is going to have. And then finally to the committee, you talked about how diverse you are, diverse in disciplines, diverse in life experience, diverse in the organizations and institutions where you served. And I know how difficult it is to come from this wide range of backgrounds and experience around as complex a topic as this. And then in 4 days, and then I think a couple of months of back and forth on email and conference calls, to come up with a report of this quality. And I'm really, really admiring of the thoughtfulness of the report and also the scholarly depth of the report. You're grounded in what you're saying, but then you've also innovated. And you've also come up with very concrete, actionable recommendations. So I'd like to conclude this morning by thanking the members of the committee and acknowledging the work that you've done to produce this report. To be continued in many, many conversations in many ways. Thank you.